Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. This week, Stephanie Desmond and I team up to talk about vaccine mandates.
Today, we chat with Professor Nancy Cass, a leading ethicist at Johns Hopkins.
I'm guessing she has an opinion on whether vaccine mandates are ethical. Let's listen.
Today, we're continuing our conversation about vaccine mandates. And today, we're going to take it from the ethical framework. Nancy Cass is our guest, and Josh Sharfstein will be joining us. Thank you both so much.
Thanks, Stephanie. Great to be here.
So I'm going to jump right in. It's great to have you here, Dr. Cass. And I want to ask this first question from the perspective of someone who really is opposed to vaccine mandates, because in a way, when they are arguing against them, it comes off like an ethical argument that it's wrong for them to be required to be vaccinated. What would you describe as the ethical basis for that, and how should we think about the strength of that argument?
Yeah, it's a great question. So in public health, we know that a lot of different things work to improve the public's health, and yet we often try to educate people to create conditions that increase the chance that people will make choices that we think are good for the public's health. And we don't always mandate things. And people who are opposed to mandatory vaccination will often say, I ought to have the freedom to decide what to do with my body and whether or not to make a choice like whether or not to be vaccinated. Very often in public health, there is a view that agrees with that says, again, let's inform people and allow them to make the choices that they feel are right to them, with a lot of education and nudging to some degree, hope that people choose to make decisions that might be good for health. Where vaccination for something like COVID becomes different is that someone choosing not to be vaccinated for COVID out of, for example, freedom to make that choice impacts the freedoms for everyone else. We're seeing that right now with the variant, where a lot of places that have opened up, a lot of places that have decided to eliminate their mask mandates are now going back to closures, to mask mandates. So the choices that people make to not be vaccinated, while genuinely they may really feel like a personal choice, end up impacting the freedoms of others.
So we don't mandate everything in public health, right? So why is this distinction here? Why vaccines? And is it because we haven't done a good job getting people to get them by their own choice?
Well, that's a really good point. And public health rarely will or ought to start with a mandate as plan A. In general, public health will do exactly what happened with COVID vaccines, which is try to both help the public understand why a vaccine is effective, how a vaccine is safe, and execute its responsibility for making it accessible in all senses of the word: cost, location, language, et cetera. If it turns out that doing all of those things leads to sufficient coverage, mandates aren't needed. And then you sort of have your cake and eat it too. You're able to maximize this ethical goal of respecting people's autonomy and freedoms and maximize the benefits that we need from a public health perspective. If it turns out that that doesn't happen, that educating people about an intervention, in this case, vaccines, doesn't lead to sufficient coverage, that's when mandates come into play. It's the same thing that happened with seatbelts, with smoking, et cetera. The plan A was education. And it was only when that didn't influence sufficient people, and it was important enough from a public health perspective, including for its implications for the other people not engaged in that it turns out that mandates become an important tool.
Now, in those cases, the rules vary. The seatbelt rules may vary depending on the kind of transportation that you're on, for example. And smoking rules depend on the environment that you're in. There are some outdoor smoking rules, but those aren't particularly universal. How do you think about vaccine mandates? Are there some situations where there's a stronger case for vaccine mandates and others where there's a weaker case? Like, what are the factors that come into play? I'll get you started maybe with one that's been on my mind, which are jobs where people are in contact with others at very high risk of serious illness or death from COVID-19, jobs in hospitals or nursing homes. Is that a stronger case? Or from an ethical perspective, is it all the same?
Absolutely. So I was also, when you started to ask the question, Josh, I was also thinking about nursing homes. And my own sense is, yes, absolutely, there is a stronger case. Mandates are only justified ethically if, in essentially saying that they're going to overrule this freedom that people generally have to make their own choices, they genuinely are preventing a harm that is consequential. It's meaningful, important, and consequential. And to the extent that we now know that vaccines really can reduce incident infection of a really bad disease, the more there is a responsibility, for example, for a nursing home to be able to say to families, when your residents are here, we have done everything we can to create a safe environment. Nursing homes and hospitals already obviously go to such great lengths and are regulated to go to such great lengths to do a wide variety of things to keep residents or patients safe. And to think that there would be protocols for how people get out of bed to prevent falls, but there wouldn't be protocols to ensure that people don't get deadly infections seems potentially inconsistent.
This makes me think of schools, right? So you've got teachers in K-6 who have these charges who can't get vaccinated, right? The children can't be vaccinated under 12. What is the ethical obligation there of a teacher? And why aren't we seeing more vaccine mandates for for teachers?
Right. So we've seen the first set of those mandates, and it will be interesting to see if more of those come along. But I agree with you. I think it's quite analogous to the nursing home situation, where obviously for different reasons, there are vulnerable individuals. And in this case, partly because the vaccine is not authorized for them yet. And partly, as we're seeing with this variant, it seems to affect kids more than COVID originally did. So there's sort of a double reason to think that there's a responsibility to make sure they're protected. And my goodness, the last thing anyone wants is to shut down schools again. I mean, speaking about harms to children.
So we've had this discussion so far where both Stephanie and I have jumped out with ideas for where the case for vaccine mandates is stronger. But I want to ask you where you think the case might be weaker now, because we're seeing all kinds of vaccine mandates. Have you seen any that are out there where you go like, the case isn't quite, compelling?
That's an interesting question. I mean, one perhaps easy first response that I have is where vaccine coverage is already extremely high, there might be a little bit less justification. Again, the goal of a vaccine mandate is to ensure that there is sufficient coverage for incident cases not to spread and vulnerable people not to be likely to come into contact. Where coverage is lower, it's an interesting question. I mean, I guess one way to think about it might be, are there situations that are lower risk? There's something about the nature of interaction that people have. It's a more open space. It's easier to stay separate where there are other ways of protecting oneself. One of the things that is often in place in a mandate is that there just are not ways for other people to protect themselves. And again, you just need the mandate for everyone else around you to be sufficiently protected.
So if a bank were to say, you have to be vaccinated to use our drive-through lane, you would say, hold on a second, what's the logic there?
Exactly. Because it not only is not justifiable ethically, in a larger sense ethically and for public health, it is so essential for our guidance and our mandates to be credible, evidence-informed, consistent, rigorous. And if we start to tell the public these kinds of situations put you at high risk, these put you at medium risk, and these put you at low risk, and then we start mandating it in the low risk situations, we've a little bit reduced our own credibility. And that's ultimately not good for public health or for ethics. Another piece that comes into this, and this, of course, exists in all different kinds of mandates in public health well beyond vaccines, is the degree to which people have reasonable ways to opt out. So in wonky ethics discussions, we will sometimes distinguish between mandatory policies and conditionally mandatory policies. And what we mean, mandatory would truly be everybody in a place needs to be vaccinated. Conditionally mandatory means if you want to go to that school, you need to be vaccinated, but you always have the option of homeschooling your kids. And these opt-outs are more or less realistic for different populations. They more or less truly represent something that can be avoided. But to the extent that it is possible to have mandates with some amount of opting out for the people who are really, really, really both opposing and can figure out a way to isolate themselves and keep separate, then that works in public health. Even for something like directly observed therapy for tuberculosis, there are people who agree to stay home and never leave their house, and there are people who are monitored and have more freedoms. And this distinction ends up being important.
And what we're seeing here really are conditional mandates, because no one said everybody in America must be vaccinated. There's no stick there. It's only if you'd like to work in certain places and if you'd like to go to specific places. So you could work around them.
Absolutely. To the extent that you have a life and personal situation where you can avoid that kind of work. So if it were to be, there already obviously are lots of health systems that have mandated vaccination for all of their employees. If one were a nurse and it turned out that every health system in America mandated vaccination, and that nurse didn't want to be vaccinated, that nurse would have some soul searching to do about what kind of work they could do. I mean, in real life, a nurse probably could get telework and other kinds of things, but it does depend on one's own situation. I will say, as just another point related to how pervasive mandates might be, on the one hand, yes, it affects the alternative options that people have. But there's another hypothesis I have, and that's all I can say, it's the only way I can describe it, that the more employers require mandatory vaccination, not just the hospitals and nursing homes and not just the universities, but as we start to see more of what we're starting to see about Walmart and Google and Disney, the more we normalize vaccine mandates, the way school vaccination has been normalized in all 50 states, red and blue, the less controversial I believe it will be. So there's this funny paradox that there's some anxiety about creating a mandate, which I completely understand for all the obvious reasons. And there are some people who are not vaccinated who push back against mandatory vaccination. But my hypothesis, and again, that's all I can describe it, that the more it becomes normal for all these employers in all these states, big national employers, little local employers, to say, look, to work here, to keep everybody else safe, to keep our customers and clients safe, we've just decided we're going to do this. The more I believe it really will be normalized. And it's not simply that people will have fewer options to get out of it. I genuinely believe that fewer people will insist that they need to have an option to get out of it.
So I hear your hope that if there are well-justified mandates, that more and more people will choose to be vaccinated and the pressure on this will come down. But I wonder whether we might see the opposite. As there are more mandates, there's greater and greater opposition. And I wonder if that, in your mind, is just a political question, or does it become an ethical question if you have such substantial opposition to vaccine mandates?
Mandates in general depend on there being a really large and consequential public health threat, evidence that a mandate makes a difference beyond something being voluntary, and the less intrusive ways don't seem to be sufficiently effective. So then there's this question about what's the role of strong opposition. Yes, that is very relevant because all of these first things which justify a mandate are essentially justifying why it's okay to overrule the wishes of some number of people who predictably didn't want to get vaccinated, didn't want to have to wear their seatbelt, still wanted to smoke in the restaurant, et cetera. And so it's sort of laying out the framework essentially for even knowing that some people aren't going to be completely on board or happy. When is it that public health can still come in and say, we're overruling that for the sake of everybody else. It's a really important harm, and here's why. To the extent that that opposition is even higher, absolutely, it's a question of politics, but it's going to, of course, it's going to overlap with what public health feels it can do. What's interesting is in watching, at least in the United States, what's going on in different states right now with the Delta variant. It seems like some of that is happening, but some of what's happening is a little bit different, which is some numbers of governors or leaders or other elected representatives in states where there has been so far more opposition to vaccines and vaccine mandates, faced with hospitals that have no more bed capacity, are starting to advocate for vaccination among their people in order to help save the state. And so it may be, this may be a Pollyanna view, but it may be that some of the crisis that emerges from allowing this much opposition might, to some degree, paradoxically, lead some of the elected folks who do have some political and cultural and human influence to say, the time has come, roll up your sleeves. We need to take care of our state. We need to take care of the people of our state.
Nancy Cass and Josh Sharfstein, thank you both for this great conversation.
Thanks, Stephanie. Always great to talk to you.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Hageder, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.